and thank you for tuning in for another session of Facebook Live. This time round, we have Dr. Agilan with us. Dr. Agilan will unravel the secrets of fertility. Do you need an IUI or IVF? So stay tuned for the whole sessions because Doctor not only going to explain the secrets and advise whether you need an IUI or IVF. We also have free gifts to give out. We have 3 baby dust, 3 free books to give out. We also have a free consultation to give out to audiences that ask questions. So how do you send in your questions? Just comment on the comment box, and if not, you can private message us. All right, just send your questions. We welcome any kind of questions. Don't feel shy, don't feel embarrassed. All right. Yeah, before going into our session, just a little bit introduction about Dr. Agilan. So Dr. Agilan is a gynecologist and also fertility specialist with more than a decade experience. He graduated from University Malaya and also get his specialist course from the UK. Yeah, so without further ado, Doctor, perhaps you can tell us what is IUI?
Okay, thanks, Jen.
Yeah.
For all the viewers, thanks for tuning in with us. Right, IUI, probably some of you have heard what is IUI. IUI actually stands for intrauterine insemination. It means we are inseminating the sperm into the uterus. Okay, now IUI is a very simple fertility treatment. Okay, there are a few criteria who will need an IUI, who will need an IVF, which we will go through in a while. Now, basically, for a couple, which couple who needs an IUI? That couple which have ovulation problems where we as a doctor will make them to ovulate by giving some injections or some tablets alone. On the day that they are ovulating, the husband produces a sperm, we prepare the sperm, meaning we wash the sperm, we discard all the non-moving, slow-moving sperms. You only take the good sperms and we directly inseminate into the uterus. Now, if you look at this model, okay, this is the uterus. This is the tube that we use for an IUI. Now we syringe out the sperm, we insert the tube into the uterus and directly inject the sperm right inside the uterus. Now, if you can see, when we inject the sperm right inside the uterus, first thing what's happening here is the sperm has already bypassed the biggest barrier for it, which is the cervix. Cervix is the neck of the uterus. Now, in a natural sexual intercourse, sperm actually is deposited in the vagina. The cervix acts as a barrier where it filters a lot of sperm. Now, in an IUI, we bypass the filter. We are actually inseminating the good sperms, so the sperm in fact has to do less work. Sperm just have to swim a shorter distance to be able to meet the egg, so the chances to have an embryo or the early baby is higher. It's about 2 to 3 times higher. So basically that's an IUI.
All right. Thank you, Doctor. How about IVF?
All right. Well, IVF is a little bit more, I would say, well, we used to say it's a bit more complicated procedure, but it's not anymore. With the current technology, I think the IUI has become much more patient-friendly, I would say. In a nutshell, the IVF means we make more eggs to grow for the woman. In the form of, we have to give her some medication in the form of injections and more eggs. We collect the eggs, right? They'll go through a simple egg collection procedure. Now, I won't even say it's a surgery because surgery sounds a bit more scary. It's not even a surgery. It's a very simple procedure done under anesthesia where the patient will be sleeping completely. About 15-20 minutes, egg collection procedure is done. So we get the egg out, we'll pass it to our lab, then the husband produces sperm on the same day. We make embryo in the lab. Okay? Once the embryos are made, 3 or 5 days later, we transfer back 2 or even 1 good quality embryos back into the uterus. Now, then the next just follows. If they fall pregnant, or if not, then if they have extra embryos, then we can repeat the process of embryo transfer later. So that's in a nutshell what IVF is. Now, as I said, with the current technology, the IVF process has become much more simplified. It means that the treatment starts with their period, either day 2 or day 3 with their period. They come in for a routine pelvic ultrasound scan. When the condition is good for them to start for the month, they'll just start the injections. Now, when we say injection, it sounds a little bit scary, but if any of you have seen a diabetic taking an insulin injection, they just use a simple pen, click on it, small needle, they just inject on their tummy. It's exactly the same. So they need the injection roughly between about 8 or 9 days. Now, and then they'll come in for follicle monitoring, meaning it's an ultrasound scan to look at the growth of the eggs. Now, based on that, we'll sometimes modify how much of the dosage of the medication we need to give. After about 8 or 9 days, once they are ready, they go through the egg collection procedure as mentioned before.
Right. So the next question, perhaps doctor can tell us the differences between IUI and also IVF. Perhaps we go one by one.
Okay.
How about we start with the time? Like, how much time do you need for IUI and how much time do you need for IVF?
Okay, right. Maybe before going for the time, maybe it's the right time now to tell the viewers who actually needs IUI or IVF. So what is the main difference now? When a couple actually sitting in a clinic, or even they are thinking about, well, we've been trying for some time, we've done some tests now, what's next, right?
Yeah.
So probably these two options will come to their mind and they'll be wondering, which is best for me?
Yeah,
right?
Correct.
Okay, now let me start with the simpler treatment, which is an IUI. Now for an IUI, typically, the couple are a bit more younger. Now when we say young, how about a woman who's at 35? Now 35 has always been the magic number. So everybody will mention 35. Once you pass 35, a woman's fertility actually drops. Now, we'll say between 35 to 37 is a grey area where things will begin to drop. Now, after about 37 or so, a woman's fertility will drop further. So, IUI process usually is done for a younger couple because her egg numbers are good. When the egg numbers are good, it means we have a bit more time to play around. I mean, the woman has a bit more time to try simple things before she needs to jump to an IVF. Okay, that's the first, I would say, a criteria, younger couple. Second criteria, the sperm have to be acceptably okay, I would say. Now, nowadays, if for couples who are coming to the clinic and the husband checks the sperm, most of the time we will find quality reduction in the sperm samples. Very rare that we'll see a perfectly normal sperm. I don't see that. Probably in the last 5 to 10 years, the male infertility have caught up. Okay, the incidents are a bit more higher, and we are beginning to pick up lower sperm quality and also lower sperm count even in a younger man. Now, when we check the sperm, when I say that it has to be a reasonably acceptable sperm, it means when we process the sperm, we need at least a few million, at least about more than 1 million, or at least more than 5 million sperm to be able to carry out the IUI procedure. That's because in an IUI, we are just inseminating the sperm into the uterus. Now, we don't know what happened after that. We don't even know that good sperms actually moved and found the wife's egg. Whether the sperm actually did what it's supposed to do, which is fertilizing an egg. Now, even that happened. We don't know whether there is an embryo formed, and if there is an embryo, we don't know whether the embryo is normal. Now, a woman may form embryo every month, but embryo may not be normal. If the embryo is not normal, then it won't keep growing and there will be no implantation, meaning the embryo did not implant in the uterus. Once the embryo implant in the uterus, then she will see a positive pregnancy test. Right? So, to have an IUI, the sperm have to be acceptably okay, or we'll say that at certain reasonable quality to be able to do all this. Now that's the second criteria. The third one is the woman must have an open fallopian tube. Now let me show you this diagram. Yeah. If you look at this, now if you look at this diagram, this is the uterus of a woman. This is the uterus lining. This is the embryo. Now this is what I said, it's not implantation. Now can you see the woman has 2 fallopian tubes. In an IUI, we are just inseminating the sperm here. Now, after that, everything happens naturally. The sperm have to swim all the way into the tube. We will make an ovulation happen. Now, the ovulated egg will be picked up by the fallopian tube. That means the woman must have at least one of the tubes to be open. Now, when the tubes are open, then the eggs will be inside the fallopian tube, where then there is a chance for the sperm to meet the egg, and there is a chance for embryo to be formed. Then everything else follows, right? So that's the third criteria. At least one of the tubes must be open. That's why when the couple goes through a fertility assessment, typically we'll check for the woman's egg, we'll count, we'll check for the man's sperm, and also sometimes we'll check the fallopian tube earlier before we start the IUI process. So basically now, if I summarize it, who needs an IUI? Typically younger couple, the sperm is a reasonable quality, at least one of the fallopian tubes are open, and the couple have not even tried a simple treatment like an IUI before.
Right.
Now usually when they have not started anything, we suggest probably you can start with something simple. Now if that works, well and good. If not, then we talk about something else. Right?
Right.
Okay, now let's go to an IVF. Okay, what's an IVF? Now, who needs an IVF? If a couple have tried IUI before, let's say they've done a couple of times, probably once, twice, even third time, things are not happening. That means probably they've had an embryo, or they've ovulated an egg, maybe eggs are not good, or we suspect the sperm probably not doing what it's supposed to do. Now in this scenario, typically the couple have to move on to an IVF, because in an IVF, the steps that I mentioned before, which is whether the eggs are normal, the ovulated eggs, whether it's normal or not, whether the sperm have actually penetrated an egg to make an embryo, or the embryo is a normal embryo. Now all these steps in an IVF we're able to see under the microscope in our IVF lab. Now that's why we're able to choose a good embryo which is of reasonably good quality, and then we transfer the embryo, their pregnancy rate actually jumps quite high up, from about 10% in an IUI to 50 to 60% in an IVF. Alright? Now, so the first criteria I mentioned, a couple have tried a couple of IUIs and then it's not working, so they move on to an IVF. Now, how about the rest? Sometimes the couple can be young, but they have other fertility issues, such as her tubes are blocked. When a woman has both of her fallopian tubes are blocked, then we can't even do a simple treatment like an IUI. It's not going to work. Okay? She needs an IVF. She needs to bypass the fallopian tube. So IVF is the way to go. Now, what about husband who has severe sperm problems, such as when the count is low, or maybe they are producing millions of sperm, but sometimes the quality is very poor. Now, in this situation, maybe IUI may not be so much of a help to them. So we will suggest that probably they need to move on directly into an IVF, even though the couple is younger. Now, typically the third group will be a couple who are, I would say, a little bit more older. Probably they are at their 36, 37 or 38. Maybe they just settled down and just beginning to start a family now. When we, after completing all your fertility assessment, then we would know that, so where the wife stands in terms of how fertility, maybe her egg counts are lower, then we will check where the man stands, husband stands in terms of their fertility count. His fertility means sperm count, so tells us that where is his fertility. Now, when all that assessment is done, then we can conclude and say, now, this is where you are, this is a timeline that you're looking at. Now, based on your age, probably IVF is a better option to achieve your pregnancy.
Okay,
Right?
okay. I think a very good explanation. Just a small reminder, send in your questions if you don't understand what the doctors is talking about, or you need more explanation from Dr. Agilan. Yeah, don't feel shy, you can private message us, or leave your questions on the comment box. You have a chance to win this amazing books, Baby Dust, and also free consultation session. So yeah, doctor, moving on. Just now we talked about the differences between the two. What about cost?
That's a magic question, isn't it? Everybody will ask this question.
Yeah.
Yes, as I said, IUI is a simple treatment, so of course the cost is lower.
Yeah.
Now IVF is, of course you need more steps involved, there are more things involved in an IVF treatment, so the cost is definitely higher. Now, the cost in an IUI, well, the cost differs from center to center, and in an IUI typically the cost is cheaper, I would say, typically less than 3,000. Okay, in IUI, depending how much of medication they need. For example, a woman who has PCOS. Okay, some of you may know what is PCOS. It stands for polycystic ovarian syndrome. Now, typically this woman, for us to make them to ovulate, it's not that easy. Now, they may need more medications. Now, if they need more medication, of course, the cost will go a bit more higher. Right? Now, for an IVF, the cost typically ranges between 15 to 18 or 19,000, depending what they need, how much of medication they need, whether they need any additional procedures such as an ICSI.
Yeah. Okay.
Now,
so that's a big difference. So when does it make sense for one like go straight to IVF and without having go through IUI?
Yeah. Well, that's a very good question actually. Now, and that's a question some of our patients will ask. Now, should I try an IUI or should I just move on straight to an IVF?
Yeah.
Okay. Now, if the couple has very clear-cut indication for an IVF, they need to move on to an IVF now. What are the indications? First of all, endometriosis. Okay, endometriosis is a condition where sometimes it reduces the woman's egg count. Okay, endometriosis is also can cause blocked fallopian tubes. Now, the woman, let's say, she could be young, she could be only 30, 31 or 32 years old. Because of severe endometriosis, both her fallopian tubes can be blocked. So now, obviously, these couples need to move on to an IVF straight away. That's the only way. Now, sometimes the endometriosis damages the ovary. How the endometriosis damages an ovary? It actually forms a cyst in the ovary. Now, they may need to go to a surgery to remove the cyst. Now, every time a woman goes to a surgery to remove ovarian cyst, during the process, some part of the normal ovarian tissue will be removed together with the cyst. That means we are removing part of a normal eggs there. So if a woman have to go through multiple surgeries, that means the eggs that she left with are few. Now in these situations, IVF is the better way to move on because she's now basically fighting against time. She could be younger, but her egg numbers may be for someone who's already at the age of 40. Yeah. So these are some clear-cut indication why IVF is better than starting with an IUI.
Okay, Doctor, we have questions from the viewers. So this patient asked about IUI and also PCOS. Is it advisable for her to take IUI if she has PCOS?
Right. Now, the woman actually, for women who has this PCOS, typically before they start the treatment, we need to optimize her first. Now that will tell us whether she can try an IUI or she need to go on straight to an IVF. Now, how do we optimize them? When we say optimizing them is, the main problem with a woman with PCOS is that ovulation. She doesn't ovulate regularly. That's why some women don't see a regular period. A woman sees a period if she ovulates. If she does not ovulate, there's no period. If a woman takes 3 months to ovulate, then a period can come in the 4th month. That's why women with PCOS sometimes they have a period every 3 months, some of them every 4 months, some of them don't even see a period entire year. Now, we typically check their insulin level. We need to bring down the insulin level. That actually improves their response to treatment. Now, once we have done that and we know that we can make them to ovulate reasonably easily, that IUI is a good thing to try. Most of them are able to do this, then we will suggest that try an IUI first, provided the sperm count is okay and her fallopian tubes are open. But this is another 2 important criteria we need to think of. Now, if everything is fine, she can move on to an IUI. Some of the women, we can't make them to ovulate. Despite all the optimization, we just can't make them to ovulate with simple medications. Now, in this situation, the woman may need high doses of medication to make her to ovulate 1 egg, and all the efforts that she have done, now she's going to put it in an IUI, which gives her probably about 10 to 15% pregnancy rate. Now, when that situation arises, now we need to start to think, now, all this effort that I've done, do I want a 10 to 15% pregnancy rate, or do I want 50 or 60% pregnancy rate? This makes a big difference. So there is no, an answer to fit all the situations. But typically IUI is the first choice for a PCOS if they fulfill certain criteria.
Okay. Is there any limitation that patient should take note if she is a PCOS patient?
Okay. You mean limitation in terms of IUI numbers?
She just said like limitation for PCOS patient to undergo.
Okay. Well, undergo an IVF or IUI.
IUI,
right?
yeah.
Or IUI, okay.
IUI and IVF, yeah.
Well, in terms of limitation, there is no limitation. A woman with a PCOS, what they need to think of is how to just optimize themselves, make it better. Whichever treatment that they're going to do,
Yeah.
they need to have a good success rate. Yeah, it could be IUI, it could be an IVF. Limitation in terms of number, let's say a woman with a PCOS thinking about doing an IUI, well, how many times they can do an IUI? In fact, there is no answer to it. If she want to try 5-6 times, well, she can. But the question is, do you want to try 5 to 6 times? Then you're talking about the time that you're going through. You're talking about the emotional cost that every time you're seeing a negative result, you keep coming again. That's something very important they have to think through. Now the next thing is also the cost. Now let's say we are not in Malaysia. We are in UK, for example. Now we'll say that you do 5 or 6 IUIs before you move on to an IVF. That's because the model that has been created there. If you do 5 to 6 IUIs, typically about 50 to 60% of the women who started the journey would have got pregnant. Now another 50 or 60%, then they need an IVF. Now in those countries, the IVFs are subsidized. And the IVFs are subsidized. Now this is the best model. You make 50% pregnant with an IUI, then the rest 50% needs an IVF. So that's the best model for them. Now in Malaysia, it's not the same. Every single IUI that you do, the cost is out of the patient's pocket. Now if you do about 5 IUIs, you don't get pregnant. If you look back at the cost, it will be equivalent to about one IVF. Now you say that you probably have done an IVF, 6 or 7 months ago, right? But as a couple or as a patient, you will never know that until you reach at that point. So typically we would say that you try about 2 or 3 times. If it's not happening, probably it's wise to move on to an IVF straight away.
Okay. Second questions. This patient has been married for 2 years, but then she has no periods for 18 months, and she has no endometriosis, and she has no cysts, but then she's not pregnant. So, doctor, what should she do?
First of all, we need to see whether she's on any hormonal treatment for whatever reason. Sometimes they don't realize the hormonal treatment can make them not to ovulate. If they don't ovulate, there's going to be no period. Of course, the next question is she need to check whether actually this patient has PCOS. How do they check? Visit a gynecologist. They'll actually take a history, do an ultrasound scan to count the egg numbers, which will tell us that whether she is in the category of PCOS or not. Now, they may even ask, well, I'm married now, after 2 years now I have this period problem. I was perfectly okay before this, right? So now the PCOS, they can present at any time. Sometimes it presents very early in their teenage years, sometimes it presents a bit late in their 30s. So it doesn't mean that if they have a normal period before this in their 20s, they don't have a PCOS. It's just that the presentation was a bit more later. So I would say for this patient that check up and then rule out PCOS first.
Okay, so the next question from the viewer is, what are the food that a viewer should avoid during a fertility treatment?
Well, it seems to be a very famous question among patients. What can I eat, what I can't eat, right? A simple answer to that, you eat, all our Malaysian diets are fine. Of course, I said fine means you're going to take care of what actually you eat. There is no dangerous food when it comes to fertility, right? If you think too much about what you can eat, what you can't eat, it's just going to add on too much of a stress, because you're not going to find a right answer to that question. So I would say that as long as you can keep up with the normal diet, it means a balanced diet, you should be fine. You're on your multivitamins as a supplement, just to add on multivitamins and also some fish oils, which is good for all the cells in your body, including sperm and egg cells, then the couple should be okay. Now, if you particularly say what to avoid, well, I don't think so. We will, or anyone for that matter, will purposely go and eat something that's going to cause harm to their health, right? Now, we don't know whether should I include smoking in the diet. Well, maybe we should think smoking in terms of diet. Now, smoking both for male and female is harmful for fertility. Probably that's the only diet I would say that they should think of.
And one should be
Don't,
like lifestyle.
Should avoid that. Yeah, smoking is known to reduce a woman's egg, okay, and also known to reduce a man's sperm count and quality. So majority of the men who come in who are heavy smokers, they'll say that, doc, I'm producing millions of sperm, right? So I should be fine. Now when they do the sperm test, they get a shock. They can have millions of sperm, 40, 50, even 60 million sperm, but they realize that 80-90% of their sperms are dead. Now they realize what's the effect of the sperm, effect of the smoking. Not necessarily reducing their count, but in fact reducing the quality of the sperm. Right?
Okay, I think people are very happy to hear that they can continue eating the roti canai and also nasi lemak.
Well, they can continue eating, but I won't say 3 times a day. Probably eating twice a week, that's fine. Because if you eat too much, you're going to put on weight, and obesity is a no for fertility, both for men and female.
How about alcohol?
Yes, moderate consumption of alcohol is fine for health. We know that we need moderate consumption. Alcohol is good for your heart, but of course when you take too much, what is too much? No, typically I'll tell my patients, don't binge drink. Now you say that, fine, for a week, 6 weeks, no alcohol. Once in a week, I said, I'm going to go out with my friends, they're done with 3 bottles. I say no, that's really, really bad. Now when you do that, typically you will drown your sperm. The sperm counts are going to be terrible, even though you say that it's only once a week, 6 days I'm fine. No. If you want to drink, spread it out, probably twice a week or so, that's fine.
How about for those that are undergoing fertility treatment, can they drink as well?
If they say 1 to 2 glasses a week, maybe it's fine. It depends also what they drink.
Okay.
So I won't say completely off, because it's nothing been proven that if you take even a glass of, let's say a wine, actually it impacts your fertility treatment. There is no such a thing. So we'll say that 1 to 2 is fine.
Okay. The next question from the viewer. So can laparoscopy treat PCOS condition?
Interesting question, right?
Yeah.
Okay. First of all, a woman is born with PCOS. Okay? That means you can't cure PCOS. What we do as a doctor is we are basically overcoming the effects of the PCOS. Okay? First of all, in severe PCOS, the woman do not see her period. So either we make her to ovulate so that she have a period. In terms of fertility, we need to make her to ovulate. Or if someone who is not thinking about fertility, typically they take hormonal pills so that they have period. When they have period with hormonal pill, it doesn't mean that we have treated their PCOS. No. They will live with PCOS for the rest of their life. Now, laparoscopy. Now, where laparoscopy comes in PCOS, typically laparoscopy are used to make the woman to ovulate. Now, historically, people have checked in PCOS, the ovaries are enlarged. Now, traditionally, when gynecologists have actually, for whatever reason, have cut the ovaries, maybe they have a cyst, they cut the ovaries, and when the ovarian volume becomes smaller, then they realize the woman with PCOS actually started to ovulate regularly. Now that's where laparoscopy comes in. What we do in a laparoscopy, typically we try to make or reduce the volume of the ovary by making few holes in the ovary called ovarian drilling. Okay, and this also brings down their androgen. Androgen actually is a male hormone. Don't be surprised, female has male hormone in their body, but not too much. Now in PCOS, the male hormone levels are a bit higher. Now by doing this ovarian drilling, we're reducing the volume of the ovary a bit and also bringing down the androgen level. That actually makes the woman to begin to ovulate. Then she sees a period regularly. Now when that happens, doesn't mean we've treated again. I say we're not treating the PCOS, we're basically treating the effect of the PCOS.
Okay. Next question. What is the success rate for women who had tied her fallopian tubes?
Alright. So I assume these women have had children before. That's the reason they tried their fallopian tube. Their success rate will be very good. First of all, because their fertility has been proven. We know that husband or wife can make an embryo. The embryo can implant in their uterus, and the uterus actually carry. Some minor technical errors. Right. And
I think the headphone is too happy already.
Yeah, the phone is jumping up and down.
Okay. Jumping in joy.
So the woman who who had a child before, it means that their fertility is proven. We know that uterus can carry a pregnancy.
Yeah.
Now their chances are very good, but depending on their age, where are they now? Of course, if they are older, the chances comes down a bit, but not too much because they had a child before. Okay, what they need is an IVF because the fallopian tubes are tight, so technically they need to bypass the tube, so they need an IVF, and their chances will be good.
Okay. Next question. What are the side effects after IUI or IVF treatment?
Well, there is no long-term side effect. Okay, people are always worried. Now we are making a lot of eggs, right? The typical question the patient will ask is, now doctor, I make 1 egg a month, right? In an IVF, maybe you take about 8 to 10 eggs. Does it mean I'm going to reach menopause earlier? Okay, that's a very logical question. Now, let me tell you what we do in an IVF, or what happens in a natural period. Okay, in a natural period, the woman actually have her ovaries are actually produces about 8 to 10 eggs every month. The body chooses 1 egg, the rest of the egg die off. Now in an IVF, we are making all those eggs to grow. So we are not actually making more eggs to grow. We are only making the eggs that are there for that month and all of the eggs to grow. So they don't really reach menopause earlier. And there is no long-term effects because of the treatments. Yes, we do give hormonal injections, and all those hormonal injections are very short-acting. That's the reason the woman needs injection daily, because they are very short-acting. What it is all these hormones are hormones that are produced naturally in their body. We are just giving it in a slightly higher dosage so that we can get more eggs. Right. So there is no long-term effect. They can have a short-term effect during the treatment. Some of the women may have a bit of mood swings. They feel slightly menopausal because they have a lot of hormones, or some of them feel as though they are pregnant. So all those are short-term, and it just wears off within that same month.
Okay. Just now you're talking about pregnancy rate, right?
Yeah.
What's the pregnancy rate for KL Fertility Center?
Right. Actually, you can look into our pregnancy rate in our website. We have a segment there, it shows a pregnancy rate. The pregnancy rate actually depends where are they. Is it the age of the couple, especially the age of the woman. For those who are less than 35 years old, the pregnancy rate is very good, about 60 to 70%, very good, provided that they don't have other major fertility issues that are preventing them from getting pregnant. Of course, the pregnancy rate comes down slowly as the woman ages.
I understand that the pregnancy rate is the data in KL Fertility Center.
Yeah.
Is that correct?
Yeah. Yeah, it's in our website.
Okay, cool. So how many IUI sessions should a patient have before she goes to IVF session?
No answer to that. Yeah, but I would say at least about 2 or 3. Now, if all the tests for them come back normal, that means we don't actually pinpoint a reason why things are not happening for them. Now they can try an IUI. I would say at least 2 or 3 times. Now, as I said, each IUI pregnancy rate about 10 to 15%. Now, if you do once, let's say 10 women start the journey, 10 couples start the journey. 1 IUI, 1 of them get pregnant, 9 don't. So statistically, the couples, their chances are not to get pregnant than getting pregnant out of 1 IUI. So we can't say too much out of 1 IUI. I can't say, after 1 IUI you're not pregnant, now IUI is not working for you. Maybe it's not true. Maybe you can try 2 or 3 times. Now, after about at least 3 times, and things are not happening, probably it's wise to think of moving on to an IVF.
Right. Okay. Doctor, I know that a lot of women out there, they want to get pregnant. So most of the time they will get pregnant through the process like IVI or IUI, IVI or IVF, but they will have miscarriage.
Yeah.
So is there any way to prevent miscarriage from happening?
No. So to answer the question, first of all, we got to know why a woman actually goes through a miscarriage, right? Most of the time, we can't find the reason. Now, among the group that we know why miscarriages happen, about 70 or 80% of the time, it is related to the embryo. Now, we have gene. We know the genetic, we have about 25,000, 30,000 genes in our body. Now, when all the genes are functioning, as the baby is growing, each genes are being switched on and on. At certain point, when the genetic is not functioning, that's when the baby stops growing, and that's when they have a miscarriage. Now, most of the time, we can't change those by what we do. It's not a woman's lifestyle that causing that. It's not that something they eat. It's not that something they didn't do. They're causing a miscarriage. So, if they ask, can they do something to reduce miscarriage? Prolonged rest, not going to make the miscarriage go away. If the woman is going to have a miscarriage, whatever they do with miscarriage will happen. Yeah. So some women will ask, should I stop working? I'm going to go through a treatment. Should I just put a no pay leave or even resign from my job so that I can have a successful treatment? Especially, you're spending so much to go through an IVF treatment. Now the answer is no. Yeah. Rest, yes, is important, but too much of rest has been shown to reduce pregnancy rate in an IVF. So I strongly will discourage that.
Okay. Yeah. So we have another question. Flaxseed is used to reduce male hormones. Is this true?
Oh, well, I never heard of that before. Now, flaxseed basically is something like a fish oil. Now, if you're non-vegetarian, I say you take a fish oil. Basically, fish oil contains omega-3, which actually good to preserve your cells in your body, including egg and sperm cells. Now, if you're vegetarian, we say that flaxseed oil. You can say flaxseed. None that I know that it reduces male hormone. Now, if you want to reduce male hormone, well, I don't think so. It's a natural way of doing things. And typically, we don't want to reduce the male hormone. Now, if you're talking about for a PCOS woman, right? Yeah. Usually, there are some contraceptive pills that actually can reduce the male hormone level, because a woman needs a certain amount of male hormone in her body. You can't completely take it away. It doesn't mean that I take away the male hormone, now the PCOS will be better and I know they have a better success rate. No, it doesn't work that way.
Okay. So will the flaxseed affect the viewer's cycles or hormones if she also taking tamoxifen?
No, it doesn't. Now, if she's taking tamoxifen to make her to ovulate, flaxseed oil should, if she's taking flaxseed oil, that's fine, because it should be beneficial, because it makes the egg quality better, and also it for the husband, it makes the sperm better actually. Yeah, it's beneficial. I don't think so it'll have any effect in affecting the ovulation process itself.
Okay. So the next question is that if a patient have decided to take IUI or IVF process, right? Yeah. How much time does it require her to be away from work? So yeah, how much should she take annual leave? Should she just take leave from her boss?
Okay.
Yeah.
No, she don't have to. Right? As I said, our technology have evolved so much so our IVF treatment has become so patient friendly. Now, when she need to come in, she come in during her period day 2 or day 3, just for a scan and start off the medication. She can in fact go back to work after that. She only come back about 4 to 5 days later for an ultrasound scan, and in overall, in the whole duration of an IVF, probably she needs about 4 visits. Maybe the 5th visit is during the egg collection process itself. Now, as I mentioned before, the egg collection process is just a minor procedure. It's done as a daycare. It means she comes in the morning, do the egg collection procedure for about half an hour, probably about 2 hours later she can go back home. Maybe on that day we give her an MC, or she take off from work because of the sedative effect, so we definitely don't want her to go back to work. Now the next day she should be fine. In fact, she can even go back to work if she need to. Now if you look into the whole entire process that I've mentioned, she don't actually have to take off from work completely for the duration of 10 or even 2 weeks. You don't have to. Yeah, a lot of these things actually is a psychology of the couple. Sometimes we feel that if I'm off the work, no stress, so probably my treatment outcome will be better.
Okay.
Yeah.
That's good news, I hope. So any best supplement out there that doctor will recommend for PCOS women?
Well, the general advice from me will be keep up your good diet, okay? Not roti chana every day, okay? Not coffee 5 cups in a day, okay? Yeah. Right? So keep a balanced diet. Now, especially coffee, you'll say about 1 to 2 cups per day is fine. It's not only coffee, anything that contains caffeine. Coffee, tea, green tea, even your Coke contain caffeine, so not too much. Take any good brand multivitamin, will do. And of course add on your fish oil. Yeah, and that will do. Now I don't see any particular diet for PCOS. Now if you go to internet, of course there are a lot of websites will say you can eat this, you can eat that, you can't eat this and that. Now if you look at all of those right now, what we want the woman, the couple to get pregnant, right?
Yeah.
If I tell you, no, you don't do this, at 12 o'clock you must eat this, at 1 o'clock you should be drinking that. Now, it just puts in a lot of unnecessary stress. And we know that stress hormone is not good if you're thinking of getting pregnant.
Okay.
Yeah.
Just a small reminder for our viewers. We are closing the session in 1:30, so you have 20 more minutes. So if you have any questions, just send them to a doctor, okay? A very good question, so keep them coming, okay? Doctor, this we will ask, can IVF be used for gender selection?
Well, theoretically you can. Yeah. How people do it, it's not here. First of all, I would like to say that in Malaysia, sex selection is illegal. So we don't do it. So I'm purely answering the question that the viewer asked.
Understand.
Now in overseas, if they do it, typically we go through an IVF process. We have an embryo in the lab. So do a genetic testing on the embryo, which will tell us whether genetics are fine for the embryo, and also it will tell you whether the embryo is a male, a boy or a girl. Then of course they can choose which one they want to transfer back. Right? So in Malaysia, it's a no. So please no, don't come to our clinic and ask for sex collection, please.
Okay.
We can't. Okay.
We got doctor's message loud and clear. So can gender selection increase the chance of a child in having autism or Down syndrome?
Okay, interesting. Now, sex selection, no. Now, when you look at, let's go through one by one. First of all, let's look into something more common, which is a Down syndrome, right? The risk of a Down syndrome increases with the mother's age, the woman's age, okay? Let's say she's younger, probably, let's say she's less than 35 years old or less than 30 years old. Her chance to have a Down syndrome probably in the range of maybe 1 in 400s, right? So the risk is lower. Now, as she approaches the age of 40, let's say she's 39 or 40 years old, the risk of Down syndrome comes to about 1 in 40, right? It's a big difference. 1 in 400 and 1 in 40 is a big difference. Now, whether she conceives naturally or even she goes through an IVF, the risk is the same. Now, sex selection doesn't change that. Okay, how about autism? Now, we know that older father or older man increases the risk of getting a child with an autism. Okay, it is not a must. It doesn't mean that if the man is already 45 or 50, telling that forget it, I'm not going to have any child. No, it's not that. It's just that there is some association with advanced male's age or paternal age with autism. Now, sex selection is not going to change that.
Okay.
Yeah.
So the next question is that if a patient get pregnant with IVF at the first round, so can she get pregnant naturally if she wants a second child?
Yes, of course she can. Not to say she can, we have enough cases, enough real life patients who actually struggled for many years. They do an IVF, they got pregnant, then a year later they say, doctor, I got pregnant naturally. Now we don't know what changed that. Probably the pregnancy itself has changed her system so that she conceived naturally. But of course, these are very minority number. Most of them who needs an IVF, they have a genuine reason why they need an IVF, and we can't change those factors. Now they will end up needing a IVF again to get pregnant, or for those who did an IVF once and they have extra embryos where it has been frozen, they just come back for a second or third child, just put back the embryos and done with it. They don't have to go through the whole process of an IVF. Yeah.
Okay. Questions from the viewer. So for overweight women, can they still undergo IUI or IVF? And what are their chances? Do you advise to reduce weight first before coming into fertility center?
Yes, ideally yes, that's the answer. Yes, you got to reduce your weight, but let's look at it practically. Okay, if you've been trying to lose weight for a few years and it's not happening, and you think that I need a fertility treatment, I'm not going to deny you a fertility treatment. But what does that mean? Of course, as a doctor, I'm going to tell you now, we look back into what you have done to reduce your weight. Probably you're not doing something right, especially for the woman with PCOS, because even though they try hard, they've done everything correct, sometimes the weight doesn't come down. That's because the insulin level is very high. Most of the time, what we notice is when we're able to bring down the insulin level, their weight comes down. Of course, I want an ideal body mass index before starting a treatment, but in ideal world we can't. Okay, so we try to optimize as much as possible before starting a treatment. So, if I want to tell someone who is obese, try your best to lose your weight, but if you find it unsuccessful, don't wait too long, because your age matters, especially for the woman. Now, if you're at 35, you say that I've tried for 4 years to lose weight, and you're standing in front of me at 39 and say that now I want to try an IVF, your chances are definitely lower, even though I'm able to bring down your weight at the age of 39.
Why embryos stop growing and cannot reach a blastocyst stage?
Okay, all got to do with if the embryo cannot grow to the next stage, which is a blastocyst, that means the embryo is genetically not normal. Okay, now if you say that now if a woman ovulates, interesting, only today in the morning the patient asked me a question. They said, I ovulate every month, right? Why am I not getting pregnant? The egg should be normal because I ovulate the egg. Now, even for a young woman, even though she can ovulate 12 times in a month, 12 periods in a month, 12 ovulation, it does not mean that every egg that she ovulates is a normal egg. The abnormal egg still can form an embryo. Now, the embryo will be abnormal. As I said, as the embryo grows, at the point that where the genetic is not being switched on and there will be no further growth, and that's when miscarriage happens. So if the embryo doesn't grow from day 3 to 5, that means there is maybe a huge genetic problem with the embryo itself.
Okay. Last questions from the viewer. Does long distance traveling more than 100 km a day affects male infertility or pregnancy?
Well, my wife travels 100 kilometers a day. I'll say no. Okay. Now, traveling doesn't actually decrease your fertility. Now, if you say traveling 100 kilometers a day, I'm assuming that you're driving 50 kilometers one way and then come back. No, it doesn't. Now, what about stress during traveling? Jam, stress. People do ask, right? Can that cause, for me, I'm traveling, then I'm scolding the driver next to me and say that you can't even know how to drive, right? All that is stressful. Yes, I agree, but it doesn't actually bring down your fertility. Now, let's look how actually stress can affect your fertility. Well, it doesn't actually reduce, let's say for a man, right? It doesn't actually reduce your sperm count. What it normally stress affects is, stress can affect your sex life, erection problem. Now, when you have those, how are you going to get pregnant? Okay. As for women, especially when they're going through a treatment, stress hormone actually can delay the eggs from growing. So of course, it's going to delay the ovulation. But when we say stress, it's not our daily life stress. Okay, well, we do have stress everywhere. I can't tell you lead a stress-free life. Impossible.
Right.
Okay, it's just too much of a stress. Suddenly someone died in your family. That kind of sudden stresses, yes, it can affect even a woman's periods, but not a daily stress that you have.
Okay, so doctor, I understood that you have some secrets to share with us, right? Secrets of the fertility, and also the title of this Facebook live session. So perhaps doctor, you can share with us now.
Okay, right. And I put the title on purpose, Secrets of Fertility, because I want people to realize, actually we have these secrets all the while with us. Okay, it's not something new. A lot of those things are actually common sense, but it's just that we don't think about it. Okay, why we don't think about it? When I start asking myself, when all these couples who are coming to a clinic, when we give them an advice, right, it's nothing, I would say, nothing fantastic or something that people, the couple itself doesn't know. That's because when we look at infertility, right, we don't look at it as a disease. We only look at infertility when we fall in the trap of infertility. Okay? Fertility, we always assume that we are fine, we're definitely able to have child, so there's no issue. Okay? So the secrets of infertility or secrets of fertility lies with how a couple or a man and a woman takes care of their fertility health. That's where the secret lies. Okay? No one talks about fertility health. Now, if you say diabetes, right, everybody talk about diabetes. If your parents have diabetes, you will say that, now I have a higher risk of getting diabetes. Even though I'm now at the age of 25, I better start taking care so that I don't develop diabetes. Now, you don't talk about fertility in the same manner. Correct? We don't view it. First of all, you got to think that if you start taking care of your fertility health from a younger age, your chances to fall into the trap of infertility is lower. That's the first thing. That's the first secret, I would say. Take care of your fertility health. Don't wait till someone tell you you can't have a child, you are infertile, then you start, going around and say that what I can do and what I can't do. That's the first thing. The next thing is start early. I don't have to say this. Your own mom would have said that. Your in-laws would have said that. Now you're pregnant, that for the next 1 year I want to see a child, I want a grandchild, right?
Yeah.
That's the reason why they say that start early, because the fertility drops with woman's age and also with a man's age. But even though maybe it's at a slower rate for a man. So start family early. That means a couple can't wait for the right moment. Everybody will wait. I wait for the right point to have a child. The right point will never come. You create your own right moment to have your family. Okay?
Yeah.
Third secret, food. We have a lot of questions about food just now. Take care of your diet. As I said, no prescription for roti canai 3 times a day. No nasi lemak every day maybe. Just a healthy diet from a younger age. Okay? And the diet means you're talking about smoking, you're talking about alcohol, moderate consumption of alcohol, and also manage your weight. Okay? And the other thing will be lifestyle. Again, alcohol, smoking, weight, and also about your sleep pattern. Okay? Not 2-3 o'clock sleep and get up 7 o'clock in the morning and rushing to work every day. Of course, they're going to throw your system off. Your body going to be pushing all its energy to concentrate on something else and not trying to get you pregnant. Right? And also the last thing will be treatment. Okay, a secret is treatment. Now, if you know that you've been trying correctly for at least about a year, okay, typically we say you try for a year, depending on the age of the couple, age of the woman. If things are not happening, be brave to take the first step to get your health checked. Why things are not happening? Probably you'll be surprised to find a reason why you're not getting pregnant, and you may need treatment early. Probably you don't find any reason, and as a doctor will tell you it's fine. You can still take some time, by doing certain modification, try naturally. So these are the things that you got to think of. Now, if you look at all what I have said, nothing is magical, right? Everything is quite common sense. It's just that we don't think about it, and sometimes you got to hear it from a third person.
Right.
Yeah, it's how things work.
Okay. Is there a yardstick or benchmark, like how long a couple try? Perhaps like 1 year or 2 years, and they still can't get the result that they want, and then that's the point of time, and then they say that, oh no, we should go and see a doctor. Okay. Is there such yardstick or benchmark?
Yep, there is what we commonly say. If the woman is younger or the couple is younger, well, what is young? Let's say they are less than 33 years old or 35 years old, right? They can try naturally they can try for about a year. They know that when are they ovulating every month. They're doing things correctly at the right time every month. Probably after a year, when things are not happening, probably they can already start to check why. Now, again, what's the caveat to this phrase of 1 year, right? Is that if the woman already know that she has factors that going to contribute to infertility, such as previous surgeries, for example, ovarian cysts, or previous surgeries to her uterus, or she know that she has endometriosis, or she knows she has PCOS, right? Probably she checked a bit earlier. Don't give about a year. Okay, maybe check earlier so that we can start the treatment earlier. The earlier we start things, the better the success rate going to be.
Okay. Thank you, doctor, for very great sharing, and thank you, viewers. You guys are really amazing. We see a lot of amazing questions. I think doctor would agree with that as well. So for those questions that we couldn't answer during this session because of time limit, don't worry. We'll come back to you soon. So doctor, I understand that you have a forum this coming 19th of August, right? Yeah, so what will you be sharing during that forum? Perhaps you can tell our viewer a little bit about a sneak peek.
Sneak peek, yeah. If you look at the title, again, I put it there with the IUI or IVF, because I noticed that every single couple, this is the question that they want to know. I mean, this is the answer to that question that they want. They want to know whether, what should I do next? So I'm just giving, the forum is basically about factors that are going to determine whether you need an IUI or IVF, and that information is going to help the couple to decide what is my next right step so that I can move on.
Okay. So for more information on Dr. Agilan Forum, it's free for admission. You just need to register. For more information is on KL Fertility Center Facebook. You just check that out and then do a registration, and you can meet Dr. Agilan in person and also ask the questions that we couldn't address during this session. Yeah. So thank you everyone for watching this Facebook live session.
Thank you for watching.
Yeah, we hope that we help you, and then if you still have any questions, just Facebook message us. All right. Let's give our viewer a bye. Okay.
Bye.
Bye.